Well, thank you, Mr. Chairman, and thank you to this committee. I am pleased to report that the FDA's approval of benzotriazole, the first new sunscreen ingredient in over 20 years in America. This came out of this committee with bipartisan support. Mr. Chairman, it shows what we can do when we work together, and I'm proud as a board-certified dermatologist to report how important new sunscreens are in preventing skin cancers, something that we've seen over the last decades, the rise in skin cancers in young individuals. Talking about working together, I would like to continue for talking about what we're doing and we're doing together with increasing transparency in healthcare. For far too long, patients and purchasers of insurance products have been kept in the dark about the true cost of medical care. While we have made important strides both administratively through legislation and passed in this committee, we know that much more needs to be done. In November of 2019, HHS issued rulemaking that requires hospitals to publish prices as of January 2021. Hospitals are required to publish a machine-readable file of 5 types of standard charges for all items and services. They are also required to create a consumer-friendly shoppable list of 300 items and services, including 70 identified by CMS. While I am pleased to see data from my home state of Pennsylvania indicates that over 90% of Pennsylvania hospitals are in compliance with key components of this rules, a November 2024 report issued by HHS estimated that 46% of all eligible U.S. hospitals were not complying with the HPT rule requirements. Less than 50%, that's unacceptable. I was further concerned to see the announcement from Secretary Kennedy and Administrator Oz that there are over 500 hospitals still out of compliance. Mr. Whaley, do you feel that the current transparency requirements are sufficient and being adequately enforced to give patients an accurate view to enable them to shop effectively for care when possible?
I think they are a good start, but not sufficient, and as you noted, not being sufficiently enforced.
Ms. Tripoli, do you concur with that assessment? It's not an adequate amount. Do you agree?
Absolutely. That's why we need the codification of the legislation being considered today.
And I think that is important legislation, again, that we can consider and implement in a bipartisan fashion. Ms. Tripoli, you also cited hospital consolidation of independent physician practices as a key driver of increasing healthcare costs. Would you view policies that incentivize independent practices as an important safeguard against the rising healthcare costs that we continue to see throughout America?
I think absolutely we want to address that incentive for big systems to buy up physician practices. The best policy solution to address that is to advance this comprehensive site-neutral payment policy.
Mr. Whaley, in your testimony, you described physician-owned hospitals showing a substantial reduction in outpatient costs when compared to their non-physician-owned counterparts. Would repealing the prohibition of physician-owned hospitals be a good initial step to stop that rising cost?
I think it would be a good step to improve affordability and add competition.
Finally, I'm pleased to see provisions of the Seniors Timely Access to Care Act surrounding prior authorization denial rates included in this hearing today. While I urge passage of this critical legislation overall, Mr. Ippolito, can you elaborate on why public disclosure of denial rates is a benefit to the American patient?
Sure. I mean, surveys have shown clearly people care a lot about denial rates. They care a lot about prior authorization rates, yet they can't really observe that. So it would be a natural feature to make clear to patients when they actually choose a plan so they can tell us how much are they willing to pay to have less denials, less prior authorization.
When you have the input from the patient, does that allow you to provide better coverage, better insight, and better education of the patient of what policies cover?
Well, sure. As a first order thing, it tells the insurance companies how to design plans that people actually want. And that strikes me as a first order importance.
I think that first order of importance, that message is not lost on us here today in the committee. Mr. Chairman, I thank you for the additional time, and I yield back.